these are the issues that folks making decisions right now are thinking about. We hope they're thinking about, and it's the types of things that if you have a strong feeling about or a strong inclination, now is the time to weigh in. Will there be an eligibility floor, like I mentioned in Medicaid? A connected lever to that is, do we have an individual mandate? If everyone has to get covered, folks may be more likely to say, yeah, put the lowest income people in Medicaid. That's an easy way to get that group taken care of. Because otherwise, you're probably going to exempt those folks and allow them to continue to be uninsured, because how could you provide them affordable coverage that they would have to be required to buy? So that's a connected issue. How will the expanded coverage be financed? We don't know, and we've gone round and round in our offices and with folks on the Hill about how you make this equitable for states and the federal government. If you do what we would call a full federal buyout and just say, okay, we're going to expand Medicaid, every state has to do it, so the federal government is going to pay for it all. Do you think the Massachusettses of the world and the Alabamas of the world are going to get along and agree about that? Because it's a tough situation. States that have been traditionally more generous, fine, buy us out, but why are you buying out the folks that haven't been very generous? They're getting a lot more bang for their buck, as it were. So that's a tough issue, and some of the big players, whether it's NCSL or National Conference of State Legislatures or National Governors Association, they're big players in this, and they must be made happy, which is not an easy thing. Similarly, what will the financial contributions be? How will you tier things in a way that doesn't disadvantage anybody else, one group over the other? For this group, probably one of the most important questions is, what will the new Medicaid benefits package be? When we talk about expanding Medicaid, we just kind of assume we mean traditional Medicaid, but that's very costly, and it's not clear whether newly covered people would be eligible for long-term care services. Would they be eligible for transportation services, some of the other services that I mentioned before that are integral to Medicaid? It's unclear whether those are going to be carried through, or whether this new Medicaid is going to be something more pared down. There's been some suggestions in the Senate Finance Committee's paper that came out a few weeks ago that low-income people that would be getting coverage through an exchange situation, and those would be folks just above a Medicaid eligibility level, they would be required to have what they are calling the lowest benefit package. There are 4 benefit packages that would be available through an exchange, and it would be lowest, low, medium, high, and the lowest income folks would get the lowest income, lowest benefit package. So that means fewer benefits, probably less cost sharing, but not something that's likely to include a robust benefit package that would include transportation services or EPSDT for children, things like that. Provider rates, obviously, there's certainly folks that want provider rates to be increased, and it's hard to argue against that. If we're going to cover lots more people, how are we going to improve access or ensure that access at least doesn't suffer? It's going to take some pretty strategic efforts when it comes to provider payment rates. That Finance Committee paper that I mentioned before talked also about pegging, raising Medicaid rates to at least 80% of Medicare rates. Not clear whether that is affordable or enough on both sides of the coin. So there are many, many questions you could add to this list, but that's a few to get you thinking.